Hi, my name is Aria Bhasin, and I'm presenting from Newton, Massachusetts. My project is a review of Tay-Sachs disease, specifically its pathology, most promising treatments, and any potential hurdles that may hinder patient access to treatment. I worked on this project with my mentor, Rami Major, and I chose to research this topic because I'm passionate about the study of pediatric diseases. And Tay-Sachs disease is a rare genetic disorder that primarily affects young children with a very short life expectancy of just 5 years of age. This provides a very short window of time for treatment, which is why this topic is so important to discuss. So first, a little bit about the disease pathology. Tay-Sachs is caused by a deficiency of the enzyme beta-hexosaminidase A, or HEX-A. This enzyme is responsible for breaking down lipids known as GM2 gangliosides, and its deficiency leads to a harmful accumulation of lipids in the patient's cells. This causes damage to the cells, which leads to the progressive neurodegeneration that is the main characteristic of Tay-Sachs disease. And this presents itself through various symptoms, including developmental delays, loss of mental ability, eventual blindness and deafness, seizures, and more. Patients tend to progressively deteriorate until they reach a vegetative state before ultimately passing away, often due to recurring infections. So there have been a large variety of treatment options tested for Tay-Sachs, but the one I'm going to focus on is gene therapy, as this has proven itself to be the most promising out of the many potential methods. So how gene therapy works is primarily it utilizes viral vectors to deliver a functional gene in order to correct a mutated non-functional gene. And this method has been tested for the treatment of Tay-Sachs in both animal models and human patients. It turned out to have many successes in mice, including delayed disease onset, preservation of motor function, and reduced inflammation and lipid storage in the brain. Gene therapy has also been tested in sheep models of Tay-Sachs disease, for which it also demonstrated promising therapeutic efficacy. Finally, it has also been tested in a clinical trial with 2 Tay-Sachs patients, which resulted in increased HEX-A activity in both children. However, it did turn out to be more effective in one patient than the other, and this may have been because they were treated earlier in the disease course. This again emphasizes the tight window for treatment that these patients have. Overall, the data from the gene therapy clinical trial is very promising and warrants further exploration into the strategy for the treatment of Tay-Sachs. And in addition to that, there are many potential challenges that may arise on the path to the treatment of Tay-Sachs, especially with a process as complicated as gene therapy. One of these is that gene therapies are typically attached to excessively high price tags, often in the millions if we look at recently FDA-approved gene therapies. Many patients may not be able to afford this, which is further complicated by the fact that it is very possible for therapies to be approved by the FDA, but not reimbursed by insurers. And this creates a lack of synergy between the different players involved in getting this treatment to the patient, leading to more hurdles in the process. In addition, there are many ethical considerations related to gene therapy access. A major one is that patients and families may, through no fault of their own, lack the genetic literacy to be able to understand the treatment they are receiving, which creates the need for specially trained medical professionals to properly explain the process and any potential risks. Finally, Tay-Sachs disease comes with a very high patient burden, which is exemplified by the complicated post-diagnosis process that patients have to endure. They often have to be evaluated by neurologists, go through MRIs, and much more, and the complexity and longevity of this process just creates more potential for issues to arise. And this is why it's so important that all parties involved are coordinating with each other to make sure this process is more efficient in any way they can so that Tay-Sachs patients receive treatment as soon as possible. So to conclude, Tay-Sachs disease is a severe genetic disorder that leads to death in the typical disease course. Therefore, it's important that researchers continue to work towards developing gene therapies for its treatment, and that governments continue to invest funding in research surrounding this topic. If you're interested in learning more, my research paper is soon to be published in the Curie Academic Journal. Thank you for listening.